be back.
Our hormones play a vital role in our overall health, and they could be responsible for many common ailments. And here to explain is Dr. Russell Bartels with Scottsdale Center for Women's Health and Vitality Hormones for Men. Good to see you.
Good to see you again.
So tell me a little bit about some of the conditions and ailments that you treat with hormones.
Well, actually, hormonal deficiencies are responsible for so many chronic ailments, and unfortunately, hormone deficiency is overlooked when evaluating for these conditions. And these conditions could be as simple as chronic fatigue issues, brain fog, chronic body aches, joint pain, libido issues, diabetes, fibromyalgia. I mean, there's a very long and extensive list. And even when some of these hormones are evaluated in the workup, oftentimes the results are misinterpreted. And that's why it's important to see somebody who's very familiar with interpreting the data and getting it in the first place.
Interesting. All right, so a lot of people are worried about using hormones. There's a lot of pros and cons, I guess, and information out there. Are they safe?
Hormones are safe, and unfortunately there's a lot of bad press out there, although that has kind of settled down over the more recent years as more data comes out in support of hormone therapy being safe. But I want to make a distinction between hormone therapy and then there's branches of, which is bioidentical hormone therapy and synthetic hormone therapy. And we stay away from synthetic hormones because that's where there might be a slight increased risk of breast cancer with synthetic progesterone. But bioidentical progesterone, for example, has been demonstrated to even reduce the risk of breast cancer. So I don't promote it as cancer reducing, but we feel very confident in its safety, whether that's progesterone, estrogen, or testosterone and thyroid. Those are some of the main hormones that we work with to solve a lot of common problems. And most commonly, it's going to be, I just don't feel like I used to. I'm running, I'm running tired. My brain isn't clicking on all cylinders. Those are some of the main issues, and body aches and joint pains, and and then followed by some of the sexual dysfunction and libido and arousal issues and ED with the men. So there's a lot we can accomplish with hormone therapy and avoid medications and minimize diabetes and heart disease and Alzheimer's and avoid medication and just replace what your body is not producing like it used to.
So who would you say is a good candidate? It sounds like this covers a lot of people.
It does cover a lot of people, and a lot of men and women think that hormone therapy is just for menopausal women. And I've been on the show before and saying, hey, you could be 20 years old with migraines, and we can give you some testosterone, whether you're a man or a woman, and make those migraines go away. So age is not really an issue. It's more about the conditions that we're trying to treat, because these are safe to use in almost everybody.
And why would you say people should come to you maybe over another place or practitioner?
Well, this is what I do, and this is what I specialize in. I didn't just take a weekend course, and now I'm an expert in testosterone. And unfortunately, there's a lot of these, clinics, especially for men. They just come in, they get a shot, they're out the door. And I see a lot of those patients come to me because they're not getting appropriate therapy. And I think we do a better job of overall assessment and treatment and follow-up.
And you've been in this a long time.
Been doing it for 15 years. I can't believe it's been that long. But and we change and we keep up to date with the newest techniques and with the data that supports what we do.
And quickly, what's the best way to deliver these hormones, you think?
We prefer hormone pellets under the skin for men and women. For women, 3 to 4 months at last. For men, about 4 to 5 months. But we're not a one-trick pony, and we offer creams and injectables and lozenges and patches, all which can fall into the bioidentical realm.
All right, Dr. Bartels, thank you so much for being here.
It's always great being with you.
And if you'd like more information on Scottsdale Center for Women's Health, visit their website, scottsdalewomenshealth.com, or call the number on your screen.